Hi everyone, I am Dr. Sunil Eshwar from Fertility, Bangalore. Today we will be discussing on a topic called as fibroid or a myoma in uterus and how we can identify whether we need to do something about it and what is the impact of this on any woman's life. So we'll be taking as a short questions. Let's see how many questions we can cover. Let's go, Dr. Datri.
Yeah, sir. So for the first question, sir, what exactly are fibroids?
Fibroids are a non-cancerous or a benign muscle growth inside or outside the uterus.
What are the symptoms that we should watch for when we have fibroids, sir?
Fibroids can cause heavy bleeding during periods, pain during periods, heaviness in the abdomen, urinary complaints, bowel complaints, and many a times they are asymptomatic. They can also be a reason for not able to conceive, which is called as infertility or subfertility.
Should you treat all fibroids?
If they are causing problem, we treat. If no, not necessary.
What is myomectomy?
Myomectomy is surgical removal of the fibroid. It can be laparoscopy or open myomectomy or vaginal myomectomy.
How do we choose which is the best type of myomectomy for us?
You should allow your doctor to choose the best way of doing a myomectomy. We generally prefer to do laparoscopic or keyhole surgery for most of the myomectomy. It could be laparoscopy, it could be hysteroscopy.
Is there any reason to do a myomectomy if there are no symptoms?
If the size of the fibroids is really large, more than 8 centimeters, or located in a place which can be a reason for infertility, that means if it is indenting the endometrial cavity, then we need to do.
How do we prepare ourselves for a myomectomy?
Basically, certain blood tests, make sure that your hemoglobin is good. Your fibroid has to be mapped, means not necessarily there is only one fibroid, there may be many. When there are many, we need to know the size, location, and also the number.
What kind of anesthesia is used for laparoscopic myomectomy?
It's general anesthesia.
And how long does the surgery usually take?
Surgery depends on the number and size of the fibroid, typically between 1 to 3 hours.
How big are the incisions in a laparoscopic myomectomy?
Number of incisions are not more than 4. The largest is 1.5 centimeter, whereas the others are 1 and 0.5 centimeter.
So how big fibroids can be removed through laparoscopy?
Size really doesn't matter. It depends on the location, blood flow, and the patient's clinical condition. We have removed even 2 kg of fibroids laparoscopically.
So how these big fibroids, how are they removed from the abdomen after the procedure?
We do a small technique called as morcellation. We put it inside the bag and cut it into a smaller bits and remove it, which is called as morcellation.
How long does the post-op recovery or hospital stay?
Generally 1 to 2 days you stay in the hospital. After that, we instruct not to take heavy work, strain or long distance travel for next 5 to 7 days. But after 10 days, we are all normal.
Will there be pain after myomectomy?
Generally for 2 to 3 days because of the procedure itself. After that, dull aching pain for at least 5 to 7 days. But after 7 days, generally no pain.
The patient usually asks, can I walk after surgery?
You can walk.
Can we run after surgery?
After 10 days.
And when can we start gym or exercise?
After 30 days.
When can we start driving?
After 5 days.
Do we usually get back our normal periods after myomectomy?
After a month.
Can we have a good pregnancy after myomectomy?
Depends. After 3 to 6 months, you can plan for pregnancy.
Can I squat after myomectomy?
After 2 days.
Can we cook after the surgery?
Immediately when you go home.
Can we have sexual intercourse after the surgery?
Whenever you're comfortable, generally after 5 to 7 days. But you need to make sure that you avoid getting pregnant because there will be some instruction. Some people, we will say not to get pregnant up to 3 months. For some people, we say up to 6 months.
What are the benefits of lap myomectomy over the open procedure?
We generally only prefer laparoscopic myomectomy. Multiple benefits: smaller scar, lesser number of incisions, less bleeding, less chance of infection, faster recovery, and you can go back to your work within 7 to 10 days. So it's more beneficial for the patient than to the surgeons.
What are the other options of myomectomy or a different type of myomectomy?
Myomectomy, 5 different types: open, laparoscopic, hysteroscopic, vaginal, robotic.
What is hysteroscopic myomectomy?
When the fibroid is inside the uterine cavity, more than 50% inside the uterine cavity, less than 4 centimeter, we can consider doing a hysteroscopic myomectomy, where we are entering the uterine cavity with the help of a small cameras and with the operative instrument attached into the uterine cavity, and we remove it in a piecemeal way.
Who is an ideal candidate for hysteroscopic myomectomy?
When the fibroid is type 0, 1 or 2, that means it's inside the endometrial cavity, indenting the endometrial cavity, less than 50% inside the myometrium, and the size is less than 3 centimeter, is the ideal candidate for hysteroscopic myomectomy.
What is the advantage of hysteroscopic myomectomy over lap?
In hysteroscopic myomectomy, we are not opening the uterine muscles, so uterus integrity is maintained. Second, as it is inside the endometrial cavity, it becomes easier for us to remove it hysteroscopically. Third, lesser blood loss, lesser hospital stay, and no incision on the abdomen.
What is the contraindication for hysteroscopic myomectomy?
Okay, this is the most important question because patient selection really matters. If the size of the fibroid is more than 4 centimeter and indenting the cavity, we still need to think about the patient's safety and consider doing laparoscopy, because we can end up having prolonged surgical time causing fluid retention and pulmonary edema. Bleeding can be more. We may have to consider doing stepwise surgery. But the advantage, like avoiding injury to the endometrium, is not happening here because large amount of endometrium can still be lost or injured. So we would still consider a laparoscopic surgery in this case. Next is, if the patient is not surgically fit, that means if you are having any cardiac condition, pulmonary condition, then we would still prefer to do a safer, quicker methods like a laparoscopic myomectomy. The last thing is, yes, if there are multiple fibroids indenting the endometrial cavity, then also we would prefer to do a laparoscopy myomectomy and avoid the injury to the endometrial cavity.
How long does the hysteroscopic myomectomy take procedure?
Depends on the size. Ideally not more than an hour, because we know if it is going more than an hour, that means there are going to be complications with the patients.
What kind of anesthesia is used?
We can use spinal anesthesia, regional anesthesia, and also general anesthesia.
Are there any stitches put during hysteroscopic myomectomy?
There are no stitches on the abdomen when you're doing a hysteroscopic myomectomy, but we do say that if reasons arise, we may consider doing a laparoscopy. At that time, maybe 2 or 3 incisions on the abdomen will be there.
How long do I have to stay in the hospital after a hysteroscopic myomectomy?
Hysteroscopic myomectomy, most of the time it's a daycare procedure. Morning you come, by evening you discharge, or not more than 24 hours.
So I can get back to my usual work at home after some time. How long will I have to take rest?
2 days is more than enough. First day just to recover out of anesthesia. Second, you will have a little bit of heaviness and pain. So just to take care of that, 2 days of rest, back to normal.
When can I start planning for pregnancy after hysteroscopic myomectomy?
You can start planning after 2 months. Just why 2 months? Take rest for a month and recover and come back.
So what are the risks involved in hysteroscopic myomectomy?
Fluid overload. If it's a very large fibroid and very vascular, bleeding can happen, infection can happen, perforation of the uterus can happen, and lastly, Asherman syndrome, which means the endometrial cavity can have adhesions causing difficulty to conceive and also sometimes no periods or amenorrhea.
Does myomectomy or fibroids affect fertility?
They definitely can affect fertility in multiple ways. One, if they're inside the endometrial cavity, implantation doesn't happen. If they're indenting the endometrial cavity, implantation of embryo does not happen. If it is very large, it will distort the pelvic anatomy. The relationship of the tubes and ovary can be lost. If it is sitting in a very crucial junction like cornwall ends, it can stretch the tubal ostia, so egg and the sperm transportation may not happen. Very large fibroids, multiple fibroids can also be a reason for pain, difficulty to have intercourse, and also pregnancy becomes difficult. So infertility, definitely we may have to consider removing fibroids.
Can we conceive if you have a fibroid?
Yes, you can conceive with fibroid in the uterus.
Should we abort the pregnancy if a fibroid is diagnosed?
No, you don't have to abort if there is a fibroid in your uterus incidentally detected.
Is fibroid a reason for abortion in pregnancy?
Yes, it can be.
If a patient has 3 fibroids in the uterus, can she conceive?
Yes, they can conceive normally.
Will you allow them to conceive normally?
Yes, we can allow them to conceive normally. Even if it is indenting cavity, we can give some time, try to see if they can conceive normally.
How long can we wait for the pregnancy to occur naturally?
We can wait for 6 to 8 months depending upon the age of the patient, AMH and husband parameter. We can definitely wait 6 to 8 months.
If a pregnancy occurs with a fibroid in situ, what are the unique complications that we would anticipate?
2 unique complications. One, the fibroid definitely is going to grow larger in size. Second, there is a unique, very unique complication during pregnancy which is called as a red degeneration, which can cause preterm delivery.
So do all fibroids cause preterm delivery?
Not all fibroids cause preterm delivery. 5 to 8% risk of preterm delivery is there, but if you are following up properly, we can avoid this preterm delivery also.
Can I travel if I'm pregnant and with a fibroid?
You can, but take your consultation with your gynecologist.
Do I need complete bed rest if I'm pregnant and with fibroids?
No, not necessary to take bed rest unless there is any other reason because of pregnancy. Otherwise, you can be normal.
Can we push the pregnancy up till term if there is a fibroid?
Yes, you can go up to term unless there is any other pregnancy related problem like hypertension or diabetes in pregnancy.
Can I have a normal delivery if I have a fibroid?
Yes, you can have a normal delivery even if there is a fibroid. Almost 80% of women with fibroid do deliver normally.
So when do we usually anticipate a cesarean section if there's a fibroid?
If the fibroid is a cervical fibroid, if the fibroid is large and stopping the progress of labor, if the fibroid is not allowing the baby's head to get engaged, then of course you may need cesarean section.
What are the complications that we would anticipate during a C-section if there's a fibroid?
There are chances of increased bleeding when you're doing a cesarean with the fibroid uterus, but the incidence is very less. Definitely can be managed with an experienced hands.
Will my uterus become weak after myomectomy?
There is nothing called as a weakness. Yes, the scar tissue is there, like cesarean, like any other procedure on the uterus. If the proper closure of the uterus is done with the proper material, definitely your uterus is back to normal, though we still call it as a scarred uterus.
Will my uterus be smaller or hollow after surgery?
Whatever the fibroids you have removed, definitely the size of the uterus will reduce, but we are only removing the part of the tissue which is abnormal, whereas the normal uterine tissue is maintained. It will never be hollow. Hollow means empty. So we will definitely approximate the muscles and make it look like a normal uterus.
Will the whole fibroid be removed in one piece or it will be broken?
We remove the fibroids by a procedure called as morcellation. So we cut it into smaller bits and take it out. Of course, if it's less than 3 centimeters, we can take it out completely in one go, or if it is larger than that, we cut it into smaller bits.
Is there any chance that we can convert a laparoscopic myomectomy into an open one?
Whenever we are doing laparoscopic myomectomy, we do take consent for open in conditions like if there is excessive bleeding or if the patient's condition during anesthesia is deteriorating. We want to go in quickly finish the procedure and come out. In that case, we will consider doing an open procedure.
Is myomectomy an emergency procedure?
Very rarely, myomectomy may be an emergency procedure. That is, if the fibroid undergoes what is called as torsion, if there is so much of bleeding that you are not responding to any of the medical methods to stop your bleeding.
After myomectomy, how fast do these fibroids grow back?
If it is a single fibroid, the chance of recurrence is as less as 2%. If there are multiple fibroids, the recurrence can be very early. We have seen in almost 20-25% of cases happening within 2 years.
Will I gain weight after myomectomy?
No,
Will my stitches open up if I cough or sneeze after myomectomy?
no, not at all.
Can I sleep on my stomach after the surgery?
After 7 days?
Will fibroids cause abnormalities in the baby?
No, fibroid is not reason for any abnormality in the baby. So let me be very clear in this video that fibroid does not cause any abnormality in the baby.
Will the baby grow normally after myomectomy or with a fibroid?
Yes, babies will grow normally, depends on your genetics and your constitutional health. So, it does not affect the baby's growth or health of the baby.